Certified Professional Coder CPC Exam Questions AAPC Practice Quiz. Question 1. A 76-year-old male with mild hypertension presents to the hospital for a scheduled surgical bronchoscopy with bronchial alveolar lavage. Moderate sedation is administered by the surgeon who completes the procedure. The procedure inter-service time is 30 minutes. What code, S, should be used to report the anesthesia services? Option A 00520 AAP2, 99,100. Option B 31,624, 99,100, 99,144. Option C 31624P2, 99,144. Option D 31,624. The correct answer is option D, 31,624. D 31,624. Question 2. In a rural area, an otherwise healthy female patient presents to the local 25-bed hospital with extreme upper abdominal pain. It is 2:30 in the morning and the surgeon on call decides that she needs an emergency splenectomy. There is no anesthesiologist present. The surgeon decides that there is no time to waste and he performs a total splenectomy using an open technique. He personally administered general anesthesia. How should this encounter be reported? Option A 00790 AAP1, 99,140. Option B 38,100 to 47, 99,140. Option C 38,100 to 47. Option D 38,100 to 47, 00790 AAP1, 99,140. The correct answer is option C, 38,100 to 47. C 38,100 to 47. Question 3. Ms. Jones, an otherwise healthy 29-year-old, arrives at the hospital in an ambulance because she has unexpectedly gone into labor. The CRNA quickly administers an epidural under the direction of an anesthesiologist. Although Ms. Jones had planned to deliver vaginally, after several hours of continued labor and minor complications, it becomes apparent that vaginal delivery was too risky. The obstetrician performs a cesarean delivery. The CRNA also provided the anesthesia for the cesarean delivery. What code, S, should be used to report the CRNA's anesthesia services? Option A 01967QXP1, 01968QXP1. Option B 01967QXP1. Option C 01961QXP1. Option D 01968QXP1. The correct answer is option A, 01967QXP1, 01968QXP1. A 01967QXP1, 01968QXP1. Question 4. Dr. Roberts, a vascular surgeon, administers a digital block to anesthetize a healthy 41-year-old patient's finger prior to performing surgery to repair a damaged blood vessel in the finger. What code should be used to report the anesthesia services? Option A 01850 AAP1. Option B 35,207 to 23. Option C 35,207 to 47. Option D. None. The anesthesia services are not separately reported. The correct answer is option D. None. The anesthesia services are not separately reported. D. None. The anesthesia services are not separately reported. Question 5. A surgeon administers general anesthesia on a 70-year-old male prior to performing an emergency partial hepatectomy to control hemorrhage. How should the surgeon's services be reported? Option A 47120-47AA. Option B 47,120 to 47. Option C 47,120, 00792 AAP1, 99,100, 99,140. Option D of 47,120, 99,100, 99,140. The correct answer is option B, 47,120 to 47. B 47,120 to 47. Question 6. An anesthesiologist personally performs monitored anesthesia care for a 73-year-old patient with type 2 diabetes. The surgeon performs a complex craniectomy for evacuation of a deep subdural hematoma. How should the anesthesiologist's services be reported? Option A 00210 AAP2. Option B 00211 AAQSP2. Option C 00210 AAP2, 99,100. Option D 00211 AAG8P2, 99,100. The correct answer is option D, 00211 AAG8P2, 99,100. D 00211 AAG8P2, 99,100. Question 7. Mr. Bear is a 72-year-old champion golfer. Other than mild hypertension, which he has had for years, he enjoys good health. However, his cardiologist recently determined that he had some blockage in one of his coronary arteries. The blockage was successfully treated by an interventional radiologist who performed percutaneous transluminal coronary balloon angioplasty of the artery. Dr. Su, an anesthesiologist, administered general anesthesia for the procedure while medically directing 2 other procedures. How should Dr. Su's services be reported? Option A 01925 ADP2. Option B 01925 AD. Option C 01925 QKP2, 99,100. Option D 01925 QKP2, 99,100 to 51. The correct answer is option C, 01925 QKP2, 99,100. C 01925 QKP2, 99,100. Question 8. A physician interpreted a CT study of cervical spine, C2-C4 area, with 4 contrast. How should the physician's professional services be reported? Option A, 70,491 to 26. Option B, 70,492 to 26. Option C, 72,126 to 26. Option D, 72,126 to 26, 62,284. The correct answer is option C, 72,126 to 26. C, 72,126 to 26. Question 9. A physician interpreted a CT of the abdomen and pelvis with contrast. The films were taken by the physician's staff in his office using X-ray equipment owned by the practice. How should these radiology services be reported? Option A, 74,177 to 26. Option B, 74,160, 72,193, 74,177. Option C, 74,177 x 2. Option D, 74,177. The correct answer is option D, 74,177. D, 74,177. Question 10. A 27-year-old female was seen by her OB/GYN for an annual checkup. Although the patient had never experienced any problems with her breasts, as a part of the checkup, her OB/GYN referred her to a local freestanding, i.e., not hospital-affiliated, women's imaging center for her biannual mammogram. 2 views were taken of each breast. After the patient left, the radiologist on duty at the imaging center interpreted the films. The images were then digitized and analyzed by computer. The physician then interpreted the digitized images and computerized analysis. The radiologist found a small mass in the left breast and reported her findings back to the OB/GYN the next day. The imaging center bills globally. How should the services provided by the imaging center be reported? Option A, 77,057, 77,052. Option B, 77,057 to 26. Option C, 77,055, 77,052. Option D, 77,055 to 26, 77,057 to 26. The correct answer is option A, 77,057, 77,052. A. 77,057, 77,052. Question 11. An interventional radiologist performed an arteriogram via the common femoral artery. The physician guided the catheter into the arch of the aorta, contrast was injected and images were interpreted. The radiologist then manipulated the catheter through the left subclavian artery, first order, thoracic branch, and into the left vertebral artery, second order, thoracic branch in the same family as the subclavian artery, where contrast was injected. Images of the left vertebral artery in the neck were obtained and interpreted. How should this interventional radiology session be reported? Option A, 36,245, 36246 LT, 75,650 to 26, 75,685 to 26. Option B, 36,200, 36215 LT, 36216 LT, 75,650 to 26, 75,685 to 26. Option C, 36,215, 36216 LT, 75,685 to 26. Option D, 36,216, 75,650 to 26, 75,685 to 26. The correct answer is option D, 36,216, 75,650 to 26, 75,685 to 26. D, 36,216, 75,650 to 26, 75,685 to 26. Question 12. A physician performed a percutaneous needle core biopsy of a breast lesion using mammographic guidance to place the needle. How should the physician's professional services be reported? Option A, 19,100, 77,032 to 26. Option B, 19,102, 77,032 to 26. Option C, 19,102, 76,942 to 26. Option D, 19,102, 77,031 to 26. The correct answer is option B, 19,102, 77,032 to 26. B, 19,102, 77,032 to 26. Question 13. How would a radiation oncologist report the professional services required to develop a clinical treatment plan involving 3 converging ports, 2 treatment areas and multiple blocks? Option A, 77,285. Option B, 77,407. Option C, 77,262. Option D, 77,263. The correct answer is option C, 77,262. C, 77,262.